The Senate Committee on Health, Education, Labor, and Pensions will please come to order. We're holding a hearing on how to improve electronic health record systems with a particular focus on the physician experience. Ranking Member Whitehouse and I will each have an opening statement, then introduce our witnesses, and after witness testimony, each senator will have 5 minutes of questioning. And first, I thank Chairman Alexander for calling this meeting and allowing me to chair this hearing on achieving the promise of health information technology. What can providers in the U.S. Department of Health and Human Services do to improve the electronic health records experience? Jonathan, you get on the internet, and oftentimes it's kind of crazy, but on the other hand, every now and then you come across something good. Jonathan Halmaka, CIO of Care Group Health Systems, recently wrote, "Providers are fed up with interface fees, how hard it is to accomplish workflows required by the accountable care business models, including care management and population health. Unsatisfied with the kind of summaries exchanging, which are often lengthy, missing clinical narrative, and hard to incorporate or reconcile with existing records." I will add on a personal note, as a physician, that time is better spent looking into a patient's eyes to make sure that she comprehends that even though she has cancer, there is hope, as opposed to clicking on a computer screen to document something unimportant to her, but required by someone far removed from the exam room. This panel will discuss how to transform electronic medical records from that just described to something better. Over the past few months, this committee has identified specific areas where EHR implementation is falling short. One of these is the overly burdensome meaningful use requirement developed by HHS. It does not just affect older physicians, the kind of the curmudgeons who remember the old days, but young residents as well. Indeed, only 11% of eligible physicians have successfully attested for Stage 2 of the EHR Meaningful Use Program, even though penalties for noncompliance begin this year. This suggests that meaningful use requirements are so burdensome that many doctors will take a financial penalty because of an inability or unwillingness to comply with burdensome government standards. Another concern is the lack of interoperability between different EHR systems. We have heard that there are reasons why interoperability are difficult to obtain. There are coordination problems where vendors implement technical standards in inconsistent ways, or adopt divergent privacy, security, or trust policies that govern how EHR information is exchanged. The committee has also heard, however, that some vendors and providers adopt business practices which block the flow of patient information. If this is true, it is inexcusable. To put it baldly, taxpayers put up $30 billion with the promise that there would be better coordination of care and therefore better health care, and it is alleged that what has been delivered are proprietary systems and information silos serving business models. If true, this is wrong and breaks trust with those taxpayers and those patients. I look forward to hearing from the panel on these issues and what Congress and HHS can specifically do to reform the EHR program so that it empowers physicians and other providers to serve patients better and delivers upon the promise to those patients and to taxpayers that their information is being used for their benefit and not for the benefit of others. I now recognize Senator Whitehouse for his opening statement. Senator.
Thank you, Chairman Cassidy.